Advanced Clinical Procedures, Periodontal Assessment Project by me, Maria Garcia. My patient's name is Joseph Joestar. His age is 65. He is a male. His ethnicity is half European and half African American. His habits in his early 20s was smoking, but has been sober since 27. Jojo is his nickname, and he started losing eyesight in his mid-50s due to trauma, causing him to quit working and retire sooner than expected. Before losing eyesight, Jojo used to work for a radiation plant in New Jersey for about 25 years. He lives in a low-income home with his wife and 2 children and a cat named Caesar. Jojo now works as a part-time singer on the weekends and for special events. His chief complaint was dry mouth, bleeding, and occasional sores as well as bad breath. My patient has chronic lymphocytic leukemia and is visually impaired. His chemotherapy medications are Fludura, Cytoxan, and Rituxan in combination. Oral complications of these chemotherapy medications are ulcers in the mouth, including tongue, lips, and throat. Oral thrush may be present due to weakened immune system. Osteonecrosis is a potential complication of cancer treatment, and due to low salivary flow, patient is more at risk for dental caries. Jojo is also, as mentioned, visually impaired, therefore may need assistance from a caregiver. My patient is taking fludarabine, cyclophosphamide, and rituximab for his chemotherapy. Fludarabine is an IV injection, 25 milligrams over m square, over a period of 30 minutes daily for 5 days. Each 5-day course treatment should commence every 28 days. Cyclophosphamide is also an IV injection, 250 milligrams by m square, 3 times a day, every day. And rituximab, 375 milligrams, is also an IV injection, and it's taken on the first cycle. Then after the first cycle is 500 mg by m square IV on cycles 2 to 6. And then you repeat that on 28 days. Special considerations. When taking fludarabine, avoid people who have the flu or chickenpox. Elderly are at risk for side effects. Don't take while pregnant and may interact with blood thinners. Cyclophosphamide may interact with allopurinol, digoxin, and St. John's wort. This medication can decrease bone marrow function. Rituximab may make you dizzy. Tell a doctor or a pharmacist if you have lung disease or heart problems, more likely to get infections. And the contraindications of the medications here is hypersensitivity for hypersensitive people, concomitant pentostatin, and kidney impairments, and that is for fludarabine. And cyclophosphamide contraindications would be severe myelosuppression and hypersensitivity. The contraindications for rituximab would be herpes simplex infection, any active fungal or bacterial infection, and patients with anemia. The oral effects of these medications would be painful sores in mouth and throat, xerostomia, and for cyclophosphamide would be Stevens-Johnson syndrome, wounds that don't heal, mouth sores, and taste is affected, as well as easy bleeding. My patient's periodontal assessment is generalized 3 to 4 millimeter pockets and localized 5 to 6 millimeter pockets on the lower right, with generalized bleeding on probing. My patient was classified as stage 2 generalized periodontitis and stage 3 localized periodontitis. The AAP periodontal classification for my patient, I chose grade B, which is moderate rate. I chose that because my patient used to be a smoker in his early 20s, and he did have some bone loss, but not enough like to be a grade C. For gingival description, I put generalized papillary slight, dark pink, bright red erythematous acute gingiva, with the gingival contour localized papillary slight, margin rolled, margin receding, papilla bulbous. And for consistency, I put generalized free Free gingiva, moderate, soft, spongy. Surface texture, I put localized. Attached gingiva, moderate, and shiny. With, I didn't check it here, but there is some loss of stippling on certain areas. Here I have my patient's FMX on the top left and an image of his dentition on the top right. According to my patient, this was one of his good days. His gums were not as red as he states they usually are. So he is a new patient in my office, so I have no idea how his normal is. But he says that he frequently gets ulcers and his gums are always red. And as you can see here, there is some redness around the gingival contour area. So his condition is he is visually impaired. He has leukemia. His AAP classification is generalized stage 2, localized stage 3, and grade B. My patient presents with generalized shiny papillary gingiva with areas free of stippling and slight gingival recession on localized teeth. Regarding posterior dentition, patient has rolled margins on molars with slight blunted interdental papilla. Mandibular anterior present with bulbous papilla. Bleeding on probing throughout dentition. The radiographs that I have here for the FMX, I put green. The green lines represents the horizontal bone loss, which is generalized. And class 3 furcation on the lower right, I put a red line around that. And the gold outline on tooth number 30 is the class 3 furcation. And I got an up-close image of that as well. My first gingival image here presents an arrow, which is pointing to the recession of the tooth and the rolled margins around it. This image here depicts inflamed bulbous papilla that is easily irritated. In this image, it shows the interdental papilla is slightly blunted. It is missing the triangular shape that normal papilla have. And there is bleeding here while probing, indicating infection. This next image that I have here is showing furcation involvement class 3 on an upper right tooth. However, the tooth that I have on my patient is the lower right, number 30. As you can see here, you can't see the furca, but the probe is going underneath through and through. My dental hygiene diagnosis for my patient, the prognosis would be poor. Rationale is patient has a visual impairment that has caused him not to be fully aware of how to properly take care of his dental health. Due to a past history of smoking, periodontal tissue such as bone has been destroyed. Leukemia is also present, causing mucositis and a high risk of cavities. The outcome would be patient will continue to have unhealthy gingiva if patient is unaware of how to properly take care of the oral cavity. With proper prescriptions, caregiver, and dental cleanings, patient will be able to prevent periodontal diseases. Modifiable risk factors would be smoking, exposure to certain chemicals, and radiation exposure. Non-modifiable risk factors would be genetics, gender, and age. For my therapeutic goals for my patient would be, for the short term, would be create a dental care routine that best fits schedule, floss regularly, brush teeth at a 45-degree angle with a soft toothbrush, use of tongue cleaner and dental aids. For long term would be reduction of plaque index score to 10% or less, and reduction of periodontal pockets plus bleeding on probing, and getting regular dental checkups. These are all of the possible ADA codes that we can treatment plan for my patient. On the next slide, I will have the days and what type of procedures are going to be done the day of the treatment. My patient's treatment plan flow chart is as follows. So for the first dental appointment, it's going to be a comprehensive exam with oral hygiene instructions. For the second dental appointment, it would be an SRP on the lower right with gingival irrigation and oral hygiene instructions. For the third day, for the third dental appointment, it would be a regular prophy for the rest of the quads that did not have an SRP, which is the upper left, upper right, and lower left, with fluoride as well, and oral hygiene instructions again. And for the fourth dental appointment, it would be a periodontal maintenance with topical fluoride and oral hygiene instructions. Now, before any dental or dental hygiene clinical procedures, during chemotherapy, consult with the medical oncologist. So this is my instrument selection. For the first thing that I want to use would be the ultrasonic insert, the Slimline brand. The green one, which is a standard tip, would be used for initiation of removal of bulk of calculus. Then would be followed by the pink thin tip for removing any leftover debris and reaching well into pockets. For the scalers, I would use the H5/33 sickle and the SN135 sickle standard for removal of any calculus on crowns or teeth of the teeth. For Gracie's, I chose 1112 and 1314 rigid, and that would be used for any tenacious calculus that is present on maxillary posterior teeth or mandibular posterior teeth. And the majority of ones that I would be using would be the universals, which is the Barnhart and the Columbia 1314 standard for removal of calculus on areas that are not as deep. The home care recommendations I would recommend to JoJo would be the ClinPro 5000 and the 1.1% sodium fluoride gel as prescription dental aids. For over-the-counter dental aids, I would recommend him the Biotine, which would be helpful for him for his xerostomia and any interdental aids. For toothbrushing, the technique I would show him would be the modified Bass technique. The type of brush that I would tell him to use and purchase would be the soft toothbrush or extra soft toothbrush, especially if he has any mucositis. Special instructions would be to brush his teeth with light pressure to avoid trauma. The toothpaste that I would tell him to use would be any mild flavored fluoride toothpaste. An example would be Sensodyne, and I would let him know to use a pea-sized drop of that. For floss and floss aids, I would recommend it to him an unwaxed floss. Could use a water flosser, perhaps on low settings. I didn't recommend the wax just because that would possibly, he would possibly cut himself more with that. For special instructions, I would tell him to slowly seesaw in between teeth contacts to get floss through and hug the tooth while moving the floss up and down for about 3 times. Then to proceed with the next contact area with a new piece of floss. Use may be precluded during cytotoxic treatment. For interdental aids, I would tell him to use the rubber tip stimulator, floss, and soft picks. Special instructions for that would be gently use aids daily. For mouth rinses, I would tell him to use the bland mouth rinse such as saline for 3 to 4 times a day and doxepin mouth rinse 0.5% for mucositis management. For fluoride, the type I would recommend would be fluoride gel 1.1% neutral sodium fluoride gel or 0.4% stainless fluoride unflavored gel. The instructions for that would be, if using custom trays, place gel in trays, apply to teeth, close mouth, and hold for 4 minutes. Then remove, expectorate, which would be to spit out, several times with no water, and avoid eating for 30 minutes. The products to avoid would be any alcoholic mouth rinses. I know Listerine does have one that does contain alcohol and one that doesn't, so I would recommend the one that doesn't. And anything that contains strong essential oils like peppermint and such. According to my patient and his needs, I would recommend moist soft foods, sugar-free xylitol gum, protein foods such as eggs, nuts, chicken, and tuna, as well as soups, because he does have leukemia, and if he's going through chemotherapy, those are great foods for him to eat. One thing I would tell him to omit from his diet when he's on those medications is foods that are cariogenic, that are sharp, and that are super acidic, which can contribute to caries. Foods that he can avoid are of things that he can avoid in his diet would be hot, spicy, salty, sharp, or high sucrose foods, or alcoholic beverages or products. The supplements that I would recommend to him would be vitamin D and iron supplements, which can improve fatigue caused by iron deficiency anemia, which is caused by chemotherapy. Since my patient has impaired vision, I would remove objects out of the way so that the patient doesn't trip on anything. And I would assist the patient to walk back into the office, the operatory unit, unless they have a caregiver or a spouse that walks them to the designated area. I would make sure to talk calmly to the patient and answer any questions that they may have. I would also not talk to them like in a loud voice, just because I feel like they maybe don't understand what I'm saying, because they do. They don't have a hearing impairment. They just have a vision impairment. Also, I would make sure that the caregiver or the spouse knows how to help the patient out, and I would get their phone number just in case they ever just drop the patient off. Then at least I would have a way of contacting them to so we could be on the same page as to what time they will pick them up. So this concludes my presentation for today, and it is based on a true story. You guys can look it up on Google and you'll learn more about JoJo and his bizarre adventures. Thank you and enjoy the rest of your day.